Across Africa, millions of people in rural communities still struggle to access basic health care. But from Suhum in Ghana to Bauchi in Nigeria, a quiet revolution is taking place, not led by doctors or nurses alone, but by ordinary citizens who have chosen to serve. They are the community health volunteers, men and women who walk miles each day to bring hope, healing, and early detection of diseases right to the people's doorsteps. In Ghana's Suhum municipality, the Youth Aid Initiative has been leading health outreaches to some of the most remote communities. Their focus: identifying hidden diseases and ensuring that those affected receive timely testing and treatment.
On a daily basis, we are in the villages seeking for people who need help, connecting to the various projects at the time that we are implementing those projects, and we help them accordingly. If I'm going to do a volunteer work, after calling my various volunteers, I set off from the office and go. Once I go to the health facility first. We have cordial relationships with the PAs and the disease control officers. We go there, we ask them if any cases have been to the facility. Once there are no cases, we then seek our volunteers if they've received or seen any cases. When they confirm, we go to the volunteers with the DCOs, the disease control officers in the various communities, and they go and verify. So once they confirm the disease or issues that the volunteer reported, we then sit and decide what help. Normally the DCO will suggest, probably sometimes the issues need to be referred to the district, and then we carry on from there.
Volunteers like Eugene and others are rewriting the story of rural health one visit at a time. Their work has led to the discovery and healing of several residents who had previously given up hope.
I was so depressed and very sad because of my condition. I had no hope. Since I came into contact with the volunteers in Suhum, I have found happiness and hope now. I followed all the directives they gave me to manage my condition, and I have seen immense results. I used to have infections almost every 3 months, but now it takes about 3 months or more before I see such.
When this guy had this condition, initially he thought when he go to the facility he will be amputated, looking at the condition and how large the wound was. But when our volunteer identified him, and we had one-on-one discussion with him, and we were able to convince him enough that with intensive food care management, the wound will heal. He went to the facility, and through the intensive food care management, the wound healed within 1.5 years. And so now he's back to his work, doing his normal activities. And again, we have people who have been in the house for so many years without going to the facility. We've been there and talked to some of them. They have accepted to go with us.
Such testimonies have become common in Suhum's outreach areas, proof that early detection saves lives. Hundreds of kilometers away in Bauchi, Nigeria, a similar approach is changing lives. There, community health influencers, promoters, and services are ensuring that even the most remote families are not forgotten.
Sometimes some patients used to call our technician in the hospital to come and check their BP. Sometimes we even used to follow them to their respective houses to go and take their BP to see how is their BP status so far it is, and let them know.
I found out I have hypertension when some volunteers came to my house and tested me. They come from time to time to test us and give us advice on how to monitor our blood pressure. I feel dizzy and headache. They came, tested me and confirmed that I had high pressure and I had this condition for about a year. We are very grateful for the help they are providing. One morning I woke up feeling like my eyes were full of pepper. A woman we know went to the doctor and we went with her. The doctor measured my BP and it was high. Since then, I have been going to Dangote Nursing and Midwifery, Bauchi Estates College, where my DP is regularly checked and they provide me with medication for 1 or 2 months at a time. I'm still taking it. Sometimes volunteers come and test us, giving advice on BP management. Sometimes I feel relief, but my DP tends to go up when I feel sad.
According to the Deputy Director of Public Health at the Bauchi State Primary Healthcare Development Board, at a technical meeting in Abuja in 2023, Bauchi adopted the idea of engaging community volunteers, and this has helped increase community screening.
2023 to date, through this program, we are able to screen up to 1,284,662 clients. Patients out of those numbers that were diagnosed hypertensive are a little about 54,000 within this period. And we had those that elevated blood pressure of up to 125,000 and above within this short period.
We screened over 1,000 people of skin-neglected disease, and it came out that somewhere about half of them were suspicious, or should I say they were having signs and symptoms of neglected tropical diseases. And so after going through it, we were looking at Buruli ulcer. These are areas I think at the end of the day we were able to get 67 of them within the last 3 quarters of last year. 67 of them being treated from these diseases, which is quite a huge number compared to the data from the District Health Directorate. Even they are doing mainstream, they are doing the actual work, and once you compare their data to what they have been getting in terms of cases and what we have also been recording, it means we are doing well.
The CHIPS model in Nigeria and Youth Aid Initiative in Ghana share one thing in common: a belief that community-led health systems work best when people trust one another.
There were 2 years ago or so, we were able to organize a community day back. And since then, we have been in contact. They deploy volunteers to the community for them to go and look out for those with skin diseases and refer them to us. And it is a plus. When you detect it early, you are able to intervene, then treatment becomes better. Yeah, so the volunteers they deployed is helping a lot. Yeah, they comb through the community, bring out the cases for management. So it's helping a lot, and it's good that they came. It's actually helping their community.
Partnership between volunteers and local health facilities is filling a gap that once left rural families without care.
You've seen clients who could not even wake up from the bedridden, and this volunteer has been able to support or assist this client to go through treatment, and the person comes back to life or comes back to, very active. This client that our volunteer reported to us, when I saw the client, I was so sad. I couldn't even look at the client. And this was just a 34 years who couldn't walk. He said he just woke up and his leg had swollen and now it's sore and all that. He lived with his mom, no wife, no father and all that. So I quickly said, oh, we could support him. So I called my boss that we had a client and we needed to support him ASAP. So my boss said, okay, then we should go to the facility. When we got to the facility said they couldn't handle that issue unless the district. So we facilitated transport to the district. When we got to the district, they admitted the patients. Now, the mother said she couldn't sleep there because she wasn't prepared that they were going to admit the child. So I just told the mom, okay, I'll facilitate your in and out every day to come and watch your son. She was crying and so the involvement of the DCU, the mother accepted. For 1 month, we went to the hospital every day. Every day we were there. And lo and behold, luckily, the guy improved and he was discharged. When we got home, the way the guy called and was thanking me, and the mom always, for consequently like 1 week, the mom always called me, thanking me, and I wasn't sad, but then I was glad I could help through the project.
Evidence from both Ghana and Nigeria proves one powerful truth. Solutions already exist within our communities. With the right support, volunteers can transform the future of healthcare from the ground up. The challenges remain: long distances, limited equipment, funding, and little recognition. Yet, their impact is undeniable.
The villages that we operate in are very, very remote areas, and network issues are there. Sometimes you can't get to a volunteer because you call the person and it's not going through. You take the risk of going there as to whether you go and see the volunteer or you not see the volunteer. But we go there, and sometimes, especially when it was raining, we get to somewhere and we realize we couldn't move again. Sometimes we needed to pass through water bodies and all that. And there was this one time that our car got spoiled. It was around 9 p.m. and even from the village to the roadside was a distance. We got home around 12. The next day we needed to go again. At a point I was like, no. But then we always encourage ourselves.
There has been an incident where you go to communities, you'll be bitten by unknown flies. And you come home, you'll be seeing swellings on our bodies. But that is a risk we have to face on the field.
I can say that the volunteer system or the model we are using is working. And it has been, our bedrock over the years in terms of achieving our objectives. And so, but the challenges we have needs to be addressed in terms of, incentivizing the volunteers. So any country or any community who want to replicate this volunteer system should find a way to motivate the volunteers enough. So the level of apathy may come down and also go back to the former days where they showed interest and excitement for working.
From Suhum to Bauchi, these are the healing hands restoring hope and dignity in Africa's most overlooked communities. They remind us that the future of healthcare isn't just in hospitals or policies. It's in compassion, service, and the courage to act. This documentary is made possible by Nigeria Health Watch with support from Solutions Journalism Network and Pent Media Center.